Researchers at ASU's Health Observatory are using environmental data to help doctors better diagnose and prevent the spread of valley fever. To learn more, we welcome Dr. David Engelthaler. He's Executive Director of the Health Observatory, part of ASU Health. Good to see you again.
Good to see you too, Ted.
Yeah. Before we get too far here, ASU Health Observatory, what is that?
Yeah, this is part of the new enterprise called ASU Health, which includes a new medical school, a new public health school, bringing together some of the other great schools around health, but building a new asset for the state of Arizona. The Health Observatory is really charged with, let's bring together health data and transform that into health knowledge. And then use that to share with public health leaders, health officials, but also the general public so we can make better decisions in our own lives.
And we're going to talk about how that affects valley fever and the investigation into valley fever in a second here. But for people that are new here, what is valley fever? Because a lot of us know what it is.
Yeah, well, valley fever is definitely Arizona's disease. This is a microscopic fungus that loves to live in hot, dry soils. And then if it gets up in the air, you can breathe it in, you can get pneumonia. It could actually cause some more serious illness as well in a few individuals. But what it does is it keeps people out of school, it keeps people out of work. It has a tremendous effect on them.
Does exposure always mean illness?
Definitely not. So actually the majority of individuals who get exposed, and the CDC thinks it's north of 300,000 people every year in the Southwest get exposed. The majority of them don't develop symptoms, or if they do, they're mild enough that they don't go see a doctor.
And again, flu-like fatigue, rashes, these sorts of things.
Correct. There's a lot of those things that you'll stay home from work, sometimes for a week or more.
Well, I remember a long time ago when I was first hearing about valley fever, the word was you get it, you're down, and you're out for a long time. Is that still the case?
It definitely can be. So people who get it, they can get walking pneumonia, and then they just want to sleep. They want to stay in bed. And that could last for weeks and sometimes even a month or more.
Is there a diagnostic test as we speak that says yay or nay, you got it, you don't?
So this is great. Arizona's institutions like ASU, like TGen, have been working in building diagnostics. So there are diagnostic tests out there, but what we're trying to do is make them faster and cheaper and smarter. So both genomic-based as well as blood-based tests.
And correct me if I'm wrong, but isn't it often misdiagnosed as pneumonia?
Yeah, in fact, most pneumonia cases are not even tested for valley fever, when a very large percentage, maybe 30 or 40% of those actually are valley fever and they're not even tested.
Can you have half and half? Can you have pneumonia and then find out you got a little bit of valley fever? Not a lot, but you got a little bit going there.
Well, anytime you have some type of a lung infection, it sets you up for additional infections as well. We see that with flu and bacterial infections. It's possible.
What kind of data now is being used to learn more about valley fever?
Yeah, one of the things that I'm excited about with the Health Observatory and with our friends at TGen too is that we're able to collect much more precise information, advanced technologies, genomics. We can use AI for interpreting this and better understand the fungus, where it lives, how it gets up into the air, and really then who's going to be at risk for exposure. So we are bringing a lot of new technology to this.
Now, and correct me if I'm wrong, gang, but looking through all of this, the idea is always after a dust storm, boy, watch out, because everything's all mixed up in the air.
Yeah.
But you're saying not necessarily. So what's that about?
You know, I grew up in the Southwest, and we heard this, stay out of those dust storms. Turns out that it's actually mythology. When we look into air filters, we see no difference in the days before these big haboob dust storms,
yes,
the days of and the days after. No statistical difference whatsoever. The reason being is that this fungus lives in the soil, typically where rodents are, rodent burrows, and that soil has to be disturbed. So down below the surface, get up into the air. So like construction or other things that will dig up that dirt. And then the surrounding region is most exposed. It's not these big giant dust storms that are moving across.
And we think of fungus, we think of something, moisture there somewhere, but really not for this, right?
Yeah, this particular fungus loves the hot, dry soils.
Wow.
Probably because it can then outcompete other things that can't grow in that.
And in looking at this, you mentioned, kind of referred to this, dead rodents, even dead rodents that are decaying like under the soil. That fungus is still there, and poof, it comes up.
Yeah, we used to think of this as just a soil fungus, but really it's an animal fungus. Animals, mammals can get it. If an animal dies underground, that body decays, and then the fungus will grow greatly right there in that location. So we see a lot of fungus around animal burrows underground in the Sonoran Desert.
So how far along is the research now into this, especially in terms of better diagnosing it?
Yes, we have, so everything from the whole system, understanding where it grows, how it gets in the air, who's going to be exposed, and then how do we better test those people. We're moving on all fronts. There are some diagnostics that are available now. We've developed some of the genetic-based diagnostics like we had for COVID, but we're also developing better blood tests at ASU.
And last question, I would imagine communication on this, learn lessons from the pandemic, huh?
Yeah, the Health Observatory, maybe the most important thing is that I think we were all searching for a trusted source of health information. That wasn't maybe the government, and maybe it wasn't the big vaccine companies. We want to build that for Arizona, where we work with all of our health partners, but then get real useful information and knowledge out.
All right, Dr. David Engelthaler, again, ASU Health Observatory. It's good to see you.
Thanks, Ted.